In commemoration of the World Health Organization's Hepatitis Day campaign themed One Life, One Liver, the Public Health Department of Lagos University Teaching Hospital highlights the importance of protecting the liver against hepatitis B and hepatitis C for living a long, healthy life. According to WHO, hepatitis B and C cause most of the disease and death, while hepatitis C can be cured. Only 21% of people living with hepatitis C infection are diagnosed and only 13% have received curative treatment. However, just 10% of people living with chronic hepatitis B are diagnosed and only 2% of those infected are receiving life-saving medicine. Amid events where health talk, free blood pressure test, hepatitis B and hepatitis C test, as well as vaccination against this kidney killer virus. Dr. Olufela, senior lecturer at the UNILAG Department of Community Health, says mortality rate due to hepatitis B in Nigeria is relatively high, but preventable on the basis of regular checkup.
One life, one liver. We realize that there is a lot of death from hepatitis B every year, and this death that we see on yearly basis, they are largely preventable, and that's the reason for the awareness. When the hepatitis B is there, they don't even go for screening, they don't know their status. A lot of time we have people coming down with hepatitis later on in life, coming down with chronic liver disease, even liver cancer, and then ultimately dying. So with this kind of enlightenment, we encourage everyone to know their status.
We might have things like fever, we might have things like fatigue, weakness, lethargy. Those are non-specific symptoms. You have one life to live, and you have just one liver to live that life with, and you can't afford to toy with that one liver for the one life you have. Like we will say, there's no spare life, and also no spare liver. Yes, admittedly, there can be liver transplant, but what is yours originally is yours. This disease presents in most cases without symptoms. So how do we know? It's by frequent screening.
The tests are normally expensive and the vaccines are expensive, but right here they are free. So on days like this, people can get to enjoy things like the vaccination and the testing free. And I'm encouraging anybody who can do this.
Because when I heard about it, I was so eager, asking my community health staffs, how do I go about it? They didn't really give me the clue earlier, but later on they called me and said today is going to be a free vaccine day for hepatitis. So I rushed down from my office.
Well, I'm saying a very big thank you to them because it's a very huge opportunity. I've really wanted to always know my status, but I've not really had the time to do it. So today I was free, and then a colleague just told me about it, so I got here.
Maria, Laudable TV.